All right, so what I'm going to demonstrate here is just to do an isometric contraction with your psoas muscle. So the psoas muscle is one of the hip flexors. It attaches to the spine. So it attaches on the front side of the spine, so pretty much through your abdominals on the TVP, so right on the side of those lumbar segments. And then it comes out on an oblique angle to the front of your hip, down deep into the lesser tubercle of the femur. So it does a flexion of the hip and also does a bit of rounding or flexion of the lumbar spine. So one way to just contract that muscle so that you can isolate it if it is a bit weak, you're gonna take a stool at home, just something about a foot off the ground, nothing super high as a chair. So what you're gonna do is you're gonna lay down, and if this is neutral, if you have your leg straight out in front, you're gonna move your leg into about 30 degrees abduction, and you're gonna put your heel right up onto that stool. And so from here, you're just gonna lightly lift your leg about 20 degrees and back down. Lift and back down. So you wanna make sure that you're trying to use that hip flexor and not torque your body to do the movement. So spine on the ground, head on the ground, base leg down on the ground, and you're just gonna lift and back down. And when you lift, you're gonna hold for 1, 2, and back down. And when doing this exercise, you always want to make sure you do about 8 to 12 in a set. So you're going to lift, 1, 2, that's 1. Lift, 1, 2, that's 2. If you feel cramping or any pain, just come out of the exercise. You can also do this exercise without a stool, 30 degrees out from the midline, and lift. And you don't have to go very high, maybe only about 30 degrees, and back down. So lift, 1, 2, back down.